everybody. Welcome. Thanks for joining us today. My name is Stephanie Menders. I'm a communications specialist from HCH Enterprises in Warwick. And today in this panel, you'll hear from the town of Warren in collaboration with HCH Enterprises how they identified and are planning recovery projects using funds allocated through the American Rescue Plan Act, commonly referred to as ARPA. So I'd like to start by introducing our panelists. First, we have Kate Michaud, who's the town manager of the town of Warren, Rhode Island, where she manages all departments and day-to-day operations. Kate holds a degree from Providence College and has served in Rhode Island municipal government for more than 20 years. She's a member of the American Institute of Certified Planners and has recently obtained certification as a climate change professional. She serves on the board of directors for the Rhode Island League of Cities and Towns, the steering committee of the Narragansett Bay Estuary Program, and the risk management committee of the Rhode Island Interlocal Risk Management Trust. Next, we have Bob Ruley, who's the director of the Office of Planning and Community Development for the town of Warren. Bob is responsible for all planning, land use, and development activities for the town of Warren. He serves as administrative officer for the Warren Planning Board, provides staff assistance to the Zoning Board of Review, and provides project management and coordination for all town projects, grant writing, and grant administration. Additionally, he provides staff assistance to the Economic Development Board, Voluntary Historic District Commission, and Arts and Cultural Commission. He's the town's lead on the Market to Medicom Climate Resilience and Economic Development Plan, which was recently recognized by the Rhode Island chapter of the American Planning Association with an award of excellence. Bob is the board chair for the Warren Affordable Housing Trust Fund, represents the town of Warren on the board of directors of Discover Newport, and is a member of the state's Traffic Advisory Committee. Next, we have Steve Earl, who's a senior project consultant with HCH Enterprises and has over 25 years experience in information systems. His career has spanned applications programming, systems analysis, management and engineering, quality management, and project management. With a primary focus on healthcare, Steve has also assisted clients in insurance, manufacturing, finance, and nonprofit services. He's a current board member, and fellow and past president of the New England chapter of the Healthcare Information and Management Systems Society. He's also a member of the American College of Healthcare Executives and the Society for Participatory Medicine. Steve received his PMP certification in 2003 and has spoken on healthcare project management at several regional and national conferences. So welcome to our panelists, and thank you for being here today. So today, let's discuss what each of you have learned about how municipalities can equip themselves with better fiscal tools, objective data, and collaboration as they move forward with their ARPA planning and project implementation. So with that, I'll turn it over to our panelists. And to start, Kate, I'm hoping that you can talk a little bit about COVID-19 just to help set the stage for this discussion. I'm sure many folks here have had similar experiences in their local municipalities, but can you just say a little bit about how COVID-19 impacted the town of Warren?
Sure. So, the town of Warren is much like many other small communities in Rhode Island and New England. COVID obviously hit us for real in March of 2020, and really immediately shut down a lot of positive development that was happening in town. So Warren is known as, really known for their restaurants, small businesses, funky little shops, and it's really interesting downtown area. And in March of 2020, I remember one of our biggest kind of initial blows that brought it all home was the restaurants had to close for St. Patrick's Day. The restaurants and bars are closed to St. Patrick's Day, and that was like, okay, this is serious. But COVID-19 really took problems that existed in the community and brought them to the forefront. So the first thing we noticed, obviously, the impact on the small businesses that didn't have a lot of reserves to begin with. They were building businesses, they were new businesses, and COVID-19 was really impactful and damaging to their business model that they were trying to follow. One of the other things that really came to the forefront immediately was problems with food security. So immediately we had issues with school children not being in school. How are they going to get fed? And then just people in general having issues with food security. I think one of the most impactful things for me was We had a mobile food pantry that set up in a park and ride in town, and so many people showed up that we had to send the police out to do traffic control because we had a line of cars that was probably half a mile long waiting for what was a limited supply of groceries that were available to people in need. So I'd like to think that COVID-19, while it had a lot of really negative and severe impacts, it also kind of opened our eyes to problems that already existed and gave us the impetus to explore those problems and to try to find ways to improve those existing conditions and to put people in a better place than they were before COVID-19 happened. So I think that's kind of what our philosophy has been with COVID recovery.
Yeah, I think the food security was a real eye-opener because the number of children that rely on getting breakfast and lunch at schools was impacted. So we partnered quickly with Hope in Maine to set them up to be able to distribute food. But then more importantly, I think, was the larger population that was impacted by that, seniors that didn't have access to the senior bus anymore to go shopping, or didn't have the ability to, we closed the senior center, so we made it difficult for them to interact and get food. And then that problem grew larger to just people in the community that were having difficulty. As Kate said, small businesses, we had to pivot pretty quickly. I mean, the Take It Outside, the first round Take It Outside money was very useful for us to help small businesses in terms of heaters. The town quickly made adjustments to allow for more outside dining if they didn't have it. And then, challenges with respect to just takeout versus people going to the restaurants. So we had some traffic issues, but all in all, I think we came out of it learning a lot of positive lessons, but at the same time having to think quickly on our feet and react. And a lot of that is still ongoing.
Yep, so March of 2020, COVID really begins to take off here in Rhode Island. March of 2021, ARPA was signed into law and allocated funds to eligible state, local, territorial, tribal governments with the goal of rebuilding a stronger and more equitable economy as the country recovered from COVID. So Steve, I'm wondering if you can talk early on a little bit about when ARPA first came out, when we first were notified about it, what were some of those challenges early on when that information was released?
Sure, when the ARPA funding was first announced, it was a little bit confusing because it seemed like it was a grab bag of opportunities across the board. And the early guidance from the Treasury was not as specific as it eventually became. So in our contacts with several municipalities, we learned very quickly that some of the initiatives people were interested in pursuing were not necessarily things that would be supported by ARPA funding. So one of the key things we had to do was develop expertise, familiarity with the law, what was going to be allowed, what was not allowed. And although they were very broad categories that offered the opportunity for a lot of different types of projects, there were clearly some that were out of bounds, and many of you know this. For example, the towns cannot use ARPA funding to resolve shortfalls in their pension funding. They can't use it to pay off some debts that were incurred prior to ARPA. You need to be able to report how the projects you've undertaken are consistent with the goals set by ARPA. And if anyone is not aware of it, the Treasury has come out with the final rule. You can get it off the U.S. Treasury website. They did incorporate a lot of the feedback they received from towns and cities across the country in terms of needing further guidance and clarification for what types of projects were available. But it was very interesting at first because we seem to be casting a very, very wide net in terms of what would be available. So I'd say the greatest challenge for us was, first of all, understanding what would and would not be allowed under ARPA, and then coming up with a basic process for how we would propose to work with the city or town to help them understand what the ARPA funding would allow, what it would require, what time lanes they needed to be aware of, and also to help them come up with a process for developing plans for how they would use the funds.
Thanks, Steve. And how about Kate from the municipal end? Any thoughts on that?
Sure, I mean, I think one of the biggest challenges was, incorporating the public's preferences, but staying within the guidelines as we knew them at that time. Obviously, we really cared about what the public held it up in a high regard and what they really wanted to see the funds spent on, but there were obvious guardrails, and it was challenging when those guardrails were moving to take the public preference and turn it into projects that would be fundable. And one of the things that HCH helped us with that we really tried to focus on was identifying the problem. What is the problem that you can attribute to COVID, and how is this project that we're looking to fund gonna help with that problem? So trying to draw a very direct line between COVID impacts and the benefits of the program or project that we were looking to fund. So that was challenging. And then just logistically, it was challenging because when the ARPA funds were first announced, we worked in town hall throughout the entire pandemic. Like, we closed to the public, but the staff showed up every day. But we still, we were having these hybrid meetings, and some meetings were virtual, and then we'd be hybrid again, and then we'd have technology issues. So it was very difficult just from a logistics standpoint to follow our normal path that we follow to engage with the town council and engage with the public and get things, have discussions and get things approved. So that was definitely a challenge. But again, we worked through it, and with the help of HCH and also, it was really helpful to work with the League of Cities and Towns. A lot of the information that we got, a lot of the best information that we got was just through conversation. I may read a rule and think it means one thing, but then I talk to some of my peers and I realize, well, that's not, maybe I'm off on my interpretation. So there was a lot of that had to happen.
Yeah, and Kate, you're already starting to talk about this a little bit, but could you maybe speak a bit about why Warren decided to partner with HCH on ARPA planning? And then Steve, maybe you could also speak a little bit about what HCH's work has been.
Sure. Even before the ARPA funds were announced, we knew as a community that we were going to have to come up with a pandemic recovery plan. So we knew that there were negative impacts to our economy and to our residents, and so we knew we had to come up with a plan to help come out of the pandemic and to get things going again. So we applied for a grant through the Rhode Island Foundation. We received the grant, and then we engaged with HCH to do some of that pandemic recovery planning. And the timing was great because we started that process, and then the ARPA funds were announced. So we were already in the process of identifying steps that we had to take for recovery, and then we had a funding source where we could fund some of those initiatives. So it worked out really well for us. Steve?
As Kate said, we were very fortunate from an HCH standpoint that Warren was already being very proactive. They had already started to put plans together before they knew that there'd be these additional funds available from the federal government. So when we came in, we actually pivoted a bit from what the original plan was in order to be able to work with the ARPA funding and develop plans for how those funds would be used. And I think we were extremely fortunate that Warren was well along in their planning and very proactive, because they kind of had their finger on the pulse. They knew a lot of the issues already that they wanted to address. It wasn't as if we were starting from ground zero. So that was extremely helpful, and they understood right off the bat that this was limited funding, that we wanted to try to come up with initiatives that would be consistent with Warren's strategic plan, that would serve the needs of their community, but not place a long-term burden on the taxpayers, because this funding is for a short period of time, and when it's spent, it's spent. We wanted to be very careful that we didn't look into projects that would require a long-term commitment that would need to be funded long after the ARPA funding was gone. So again, we're fortunate. Bob had a project management orientation. He and Kate were very supportive of the idea that we wanted to take a structured project management approach to this, identifying not only the rules and regulations we needed to abide with from an ARPA standpoint, but knowing who the stakeholders were, knowing what the major initiatives were, and being able to work with the stakeholders in the community, with the town officials, to nail down specific projects within the scope of the areas that they were hoping to address. I was kidding Bob, as some of you might guess, I'm one of Santa's helpers, and I was sharing that come December, I've got lots of little kids sitting on my lap saying, I want this, I want that, I want this. Bob and Kate were getting that from all their constituents in Warren as soon as they heard there was some additional funding available. So it was a very big challenge to decide, okay, which initiatives are we going to focus on, and how much can we really give to each of these initiatives? Because quite honestly, some of these organizations could have justifiably asked for the whole allotment for the town. You couldn't do that. So the challenge was, how do you accomplish the maximum benefit given the funds you have, but distribute it as equitably and fairly as you can, so it's going to do the most long-term good for the town.
Great, that leads into my next question for Bob, actually. I'm hoping to get into kind of the meat of the projects that Warren is working on. So can you just say a little bit about what projects have Warren identified and sort of the process for identifying those projects?
Yeah, I mean, we knew it was important from the Treasury guidelines that we needed to be transparent. So internally, Kate and I discussed what we thought some of the priorities should be. We had 10 priorities that were identified, and then we put those out to the public in terms of a survey for them to rank what they felt was important. And we felt that was consistent to what Treasury was requiring us to do in terms of transparency. And from those 10, it was interesting to see what the ranking was. The number one concern that people had and a priority was to improve food security for children in grades K through 12. The second one was for a storefront improvement program in a qualified census tract, which was also a requirement of the Treasury rule that you had to have an area that was impacted, but it also had to be a qualified census tract, which our downtown area is. The third was to compensate the town for lost revenue to COVID-19. One thing we wrote, the fourth was to expand for a new fire rescue station. One thing that we learned through COVID is just trying to find locations to do testing, finding locations to do vaccinations. So we were at the schools, we were at churches, we were at a number of different, we're at a manufacturing facility. The fifth was improving broadband infrastructure, because obviously with the number of people working from home, students learning from home, telemedicine, the need for reliable broadband, particularly in the East Bay and Aquidneck Island, has been a topic of discussion for the last several years. We had recently stood up a health equity zone in town, so we wanted to help them in their efforts. The number 7 was providing seed funding for an affordable housing trust fund. We had an ordinance creating the trust fund for several years, but never had funding to put into it. 8th was communicating project plans about ARPA to the community. Number 9 was assistance with data analytics. Early on, we were very fearful about what the reporting requirements were going to be, both for the town and maybe there's some sub-recipients. And so we wanted to make sure that we were tracking all that properly. And then the last issue was transportation issues for employers. So our manufacturing employers have people that worked carpooled, and with COVID, they weren't able to carpool as often as they were. And that particular corridor doesn't have reliable or regular public transportation. So that was a concern for us, but not necessarily for the community, because that came in at number 10. So from that, I think some of the projects are already underway. Hope in Maine asked for funding that they could continue they started a program called Nourish Our Neighbors. So what they are doing is basically, if you buy a meal, they donate a meal. That kept people that were using Hope in Maine as starting their businesses, kept them working, and it also allowed to get food out to the community. So they're using some of their funding for more freezers that they can locate throughout the community, so people can get these meals. We did start a storefront improvement program. We're giving grants of up to $25,000 for businesses that are in the downtown area for facade improvements. Historically, in the past, we might have got those funds from CDBG, but that funding source seems to have dried up for us. And we've started that program. I think we have 5 applications already for the facade program. We're moving forward with doing due diligence on a location for the rescue station. We've got property under option agreement now. We're doing soil testing and test pits. Broadband, we did a community survey both to residents and businesses, including a speed test. We're getting that initial results back. With the amount of money that the state got through the infrastructure bill for broadband, we're partnering with the state in other communities in the East Bay and on Rhode Island to help formulate, support for current legislation to stand up the broadband office, B, to understand where infrastructure is, and also how we work in collaboration in terms of making sure that we're not underserved. We're working with the Health Equity Zone. They've assisted us with a survey on affordable housing. I mean, obviously housing has been an issue for the entire state, but we want to have a better understanding of basically what is the housing situation in Warren in terms of what are people paying for rent, and what the quality of that housing is. We put $250,000 into the Affordable Housing Trust Fund, so again, any property owner that has a vacant second or third floor in the qualified census tract can get a grant of up to $50,000 to rehab that property and commit it to affordable housing. I think we're very transparent with the community, so all the programs that we're funding, I mean, we're trying to get as much information out on the town's website as well as in the local paper to communicate what's available and then what we're doing. And then we're also, the last piece that we're working on is setting up a dashboard so we can track the funding and the subrecipients and make sure that we're in compliance with the Treasury requirements.
Great, so it sounds like you were really able to identify existing businesses or community partners to create sort of an effective plan for distributing and allocating those funds. And I know that Warren has had to create a charter between the town and some of these entities. So I'm wondering, Steve, if you can speak a little bit about that and what HCH's role has been in supporting that.
Sure. We looked at each one of the possible initiatives as a separate project. And for those who are familiar with the general concepts of project management, we wanted to identify such things as what is the specific objective of this project? Not just that we're going to try to make something better, but concretely, what are we going to try to accomplish? How will we know when we're done? How will we know if we've been successful or not? We want to seek results that are measurable with clear outcomes. Identifying the different stakeholders. I think that the town was very successful in terms of working with existing organizations. They have very good communications with them, fortunately. So we're able to leverage some of the resources that were already in place, take advantage of people that were already doing very important similar work in terms of defining what their needs are, what the project should entail. A big part of it was trying to identify and anticipate potential risks, determine roughly what cost benefits might be to each initiative. That's very important for the town leaders to have an idea of if there are projects that are going to lead to increased revenues or better outcomes, whether it's providing more housing, more job opportunities, improved health care. That's all part of the cost benefit rationale that needs to be taken into consideration. So we started off with some rather lengthy formal project management charters, condensed those because we wanted to be able to communicate this effectively to members of the town council, members of the participating organizations, and the community at large, so that they would understand what the intent of each project was, what the success or failure criteria would be. And that was actually very helpful, I think, in terms of the survey. Warren was very transparent with the public. They tried to get the word out as clearly as they could. And I think the citizenry felt that they were very well informed and that they were able to make intelligent choices when they responded to the surveys in terms of which initiatives they thought were most important.
Great. So as part of ARPA, you have to be able to go back and prove that these projects have a positive impact. So Bob, I'm hoping you can speak to a little bit, how is that going to be measured, and ultimately, what are you hoping to accomplish with these projects?
Yeah, so I mean, if Water Street, put a lot of money into Water Street in the last several years with money from the Commerce and from the state, and there are very few vacancies, and people that had seen Water Street 10 years ago will talk about, what a great place it is. Main Street and Upper Child and Market Street were not seeing the same amount of investment. I like to look at streets like Smiles, and I would say Main Street needed some dental work. So the facade program, there were several properties that are going to benefit significantly by the facade money. That will fill in some of the gaps in the Smile. And again, the response to that program has been really robust. We're requiring that they go before the Historic District Commission only because our downtown is a historic district, but many of the properties that I hoped would take advantage of it are. We're also trying to incorporate some public art into that as well. In terms of the affordable housing, obviously Main Streets work when there's people, you can put feet on the sidewalk. The opportunity to kind of take some of these vacant second and third floors and create more housing opportunities where people have access to public transportation, have access to other amenities, I think is gonna, again, help our downtown. If you ask me, in the perfect world, our downtown would be whatever you imagine 1950s Main Street to be. So I think that if we're able to backfill some of those spaces with housing, that will be successful. And the rest of it, I think is, getting more awareness with the health equity zone as part of their affordable housing survey. They went door to door, they had college students come. So at least communicating with people, and that wasn't really just to get information on the affordable housing, are they aware of other services that are available? Are there things that they need? So it was at least communication from the town back to the population. And the same thing with broadband. If we're able to use the information we got from broadband for the greater good in terms of making sure that whatever way the state decides to spend this money, that they're getting feedback from the communities, not just from Warren, but the other communities, I think it's going to be useful and beneficial for everybody.
Great. And I know that these projects aren't all completed quite yet, but Kate, looking back on the work that you've been able to accomplish so far with the ARPA planning, what are some sort of key takeaways looking back at what you've been able to accomplish, or maybe lessons learned, best practices, recommendations that you'd like to make for others?
So one of the things actually was brought up in one of the morning sessions by East Providence was just the value of the survey process. I know everyone's done surveys, completed surveys, but in this case the process was really, really helpful. And not only did we ask people to rank their preferences, but we gave them an opportunity to kind of give free-form comments about why they chose the way they did. And obviously we got a lot out of the public preference ranking, but I think we got even more out of the comments that we received because they were very thoughtful. There was a lot of good information there, and it helped us kind of to troubleshoot to see, where might there be a weakness in a project, and what issues do we have to address before we even get started. So that was a really good process, and I think just the collaboration. I think, we've always tried to work collaboratively. Bob talks about regionalism a lot, but I think that this process really brought it to another level. We had to work collaboratively with nonprofits, with community organizations, with faith-based organizations. With members of the public, with the elected officials. It really had to be a completely transparent process, and it's challenging to do that, especially during a pandemic. But I think that we got creative, and really it was a situation where the more voices that were involved in the process, I think the better the outcome, and I think that's how we got to where we are now, is because we built a broad base of support before moving forward on anything. So I would say that those are probably the two biggest lessons, but also, like I said in the beginning, not losing sight of what the purpose of the money is. So the purpose of the money is to mitigate COVID impacts, and just, for every project, it's easy to get kind of pulled in a bunch of different directions because there's so many needs, but just bringing it back to that initial idea of what's the COVID impact that we're addressing, and how is this project going to address that impact? So I think that was very helpful, and the project charter certainly helped with that. I still go back to those project charters when we're working, because obviously we're still working through implementation. I'll still go back to that charter and say, are we still working towards the goals that we identified? Are we still following the methodology that we identified? And it helps us to keep on track. And now I think we're also in a better position now that the IIJA money is going to hopefully become available at the end of this calendar year. I think we've situated ourselves so that we'll be in a really good position to apply for those competitive grants when they become available.
Great. Bob and Steve, any other final thoughts to build on there?
No, I think the amount of community that was created as a result of the pandemic has been positive, and that's sustaining itself going forward. People became kinder, perhaps, maybe, and more aware of their neighbors. That perhaps they didn't think they would have a food insecurity issue, but maybe that became clearer to them through this. I think communication improved significantly as a result of it. We've always had a good relationship with our elected officials, both at the local, state, and federal level, and we maintain that throughout this. So I mean, I think there are positives that came out of the negative, and if we're able to continue to sustain that going forward, I think we're going to be a better place because of it.
And I think it's been very interesting that Warren has taken more of a long-term view about these ARPA funds. It's easy to spend the money. Anybody can spend the money. It's challenging to make a wise investment of that money. Bob and I were talking the other day, and I said, I remember as a kid being in a national park or seeing a bridge and saying, what's WPA? What was that? And learning about the Works Progress Administration and the Roosevelt administration. A lot of those funds went towards things that people still appreciate and use today, things that people still benefit from long term. And I think that if you're planning wisely with the ARPA funds, your kids, your grandkids are gonna say, gee, what did you do with that money? And they'll be able to look at things that you helped to implement, that you helped to make happen, that have long-term benefits. It wasn't just a quick flash in the pan where we got an infusion of cash and everybody was happy and 6 months later they forgot. Building something of value and being able to tie the ARPA projects in with long-term challenges that were exacerbated by COVID, I think was one of the critical factors in Warren being able to get very good projects for their funding.
Great, I think that's a wonderful final thought, so thank you so much to our panelists. And we'd like to open it up to any questions as well.
I'll go ahead and start. One of the things that you talk a lot about is improved communication, getting the public involved. Well, we all know public input is really difficult to get. How did you get success then? How did you get people to show up or respond or do whatever? And what kind of response was it? Was it 3% of the public? Was it 1? Was it 10?
I'm always disappointed on survey results because, I mean, it's always typically in the single digits. I think Warren is unique that I use the term civically obsessed, and I mean, that's just the unique character of the town. So it wasn't difficult to get people to engage because they're already engaged, and but to get them to feel like they were contributing to what the solution was, I think was empowerment for the residents. And as I said, I think we're surprised to see that the community was aware that food insecurity was such an issue that they ranked it #1. That was both eye-opening but encouraging as well. And I think when they see that those people that did respond, that we prioritize what they prioritize, I mean, I think it kept them engaged in the conversation. But we got a lot less money than many other communities just based on our size. So we always have to make $1 worth $1.30. And I think, as we approach this is how we looked at it. But we were broad in terms of how we were spending the money. So, just going through the programs that we're funding, that's a pretty wide constituency. So you've got small business in there, you have property owners in there, you have people at Hope and Main at many different levels. So that net was pretty wide in terms of how we were capturing people to get their input and engagement.
And what were those tools? Was it door-to-door? Was it a mail-in survey? Was it? Internet,
town's website, information in the local paper. the town doesn't have a Twitter or Facebook feed, but there are a lot of neighborhood and town-wide social media. So we were able to get word out that way. Town council meetings.
And I think I'll add that the process is still ongoing, so we're still collecting information through a housing survey I think it's closing in the next couple of days, but housing survey, broadband survey, partnering with organizations that do community engagement on a regular basis, partnering with Housing Works, partnering with the Warren Health Equity Zone, with EBCAP, the East Bay Community Action Program. They were able to use their networks and their resources to get people to respond to these surveys and to make them aware that we're looking for that public input. So I think, if it was just the town doing it on our own, we wouldn't have been as successful, but we were able to bring in some of those community organizations that had, their own outreach capacities already that we were able to take advantage of.
Awesome.
And I'd just add that being aware of the diversity in your community is very important when you're seeking public involvement and feedback. A lot of the communities have very high Spanish-speaking or Portuguese-speaking communities, so important not to forget that not everyone speaks English and not everyone can read and write.
Any other questions? I have a question. You spoke a little bit about broadband and investing in that. Can you say a little bit more about what that's going to look like and where that is in the scope of the project?
Sure. I love talking about broadband. So Rhode Island is one of, I think, 2 states in the country that doesn't have an office of broadband. There's
Us in Mississippi.
The East Bay and Aquidneck Island have been underserved, and it's something that we've been discussing, regionally for the last 3 years. So getting information in terms of, what is the situation in Warren in terms of what consumers were experiencing, but there's been legislation in the last 2 years to, both in the House and Senate, to stand up an office of broadband. So we wanted to make sure that we were supportive of that legislation. We know that the state was getting money through the infrastructure bill for broadband. We know that the governor has money in his budget for broadband, but what was that going to look like? The idea that 39 municipalities would get a piece of the federal money was not something we saw to be a good idea, and that's something that's shared with our regional partners in other communities. But also making the case that, in this day and age, the fact that we don't have access to fiber on every street is a priority. Just looking at, in the survey that we did, we had a speed test embedded in that, and what most people will see is that the upload speeds are ridiculously slow, and that's because it's not fiber. Or, if you have fiber on your main road, you're still copper into the house. And just seeing the amount of people that were using the internet during COVID from their houses, that just slows everything down. If you're in a condo complex or an apartment complex, whatever Cox says you have panoramic Wi-Fi and you get fast speeds, that's not always accurate. So the more information that we could get about that is important. Understanding the age of somebody's computer. If you have a computer that's 10 years old, you can have fiber, but you're not going to have fast speed. So we're trying to use all that information, again, on a regional basis, but also to inform the state as they look at this pending legislation and how they stand up what that broadband office would be and what's it going to do. So it's helpful for us. It's, as I said before, it's education, telemedicine, remote working, but it's also security in schools, businesses that are seeing more internet action, and even during the pandemic, we had people saying that the amount of credit cards that people were using, that they were having a hard time processing it because their internet speeds were slow. So maybe that's a long answer to your short question.
And I'll just add one more thing, is that, if the state's legislation is successful and they're able to unlock the next round of federal funds for broadband, potentially the state of Rhode Island could have $100 million into the state for broadband. So we really want to make sure that we're ready to apply for those funds and to capitalize on those funds. So we're using the ARPA funds to position ourselves potentially for this $100 million that could become available through the state, through that federal funding. And obviously we're focused on speed, but we're also focused on reliability and affordability. So through this survey, we're trying to, if you have fiber availability, but you can't afford it, then it's no good to you. So trying to understand kind of all those aspects of broadband.
Yeah.
When you were reaching out via social media or your websites or anything, were you thinking accessibility as well for the older individuals who may not use that, or the blind, with Braille or anything? How were you reaching out and making sure you were being inclusive or asking the questions if people needed the accessibility portion of it?
I mean, I think that's where the Health Equity Zone has been very helpful, because they actually engage people to go door to door to help with the survey. So they had tablets with them, and if somebody didn't have a computer or didn't have access, they would sit with them and go through the survey with them personally. So that's something that the town, we don't have the human resource availability to do something like that, but by partnering with the Health Equity Zone, we were able to do that one-on-one outreach to people who may not even know that this is going on. But we are a relatively dense community. We're small, but we're dense, so it was easier for people to actually do that door-to-door interaction. The HES also had an event for families at a local business where they had information about a number of resources that were available. But again, they had tablets available at that event. They had people available to sit and go through the survey with people one-on-one. And I think they even gave out, they had a raffle for gift cards for people who completed the survey as an incentive. So I think it certainly would have been a challenge if it was just the town trying to do that work. But by partnering again with these community organizations, I think that we made it more accessible.
Yeah, I mean, our qualified census tract is 305, which is predominantly our entire downtown area. And over that weekend, the HES with students from Brown and Roger Williams made an effort to go to every residence in that census tract. I mean, with our seniors, I mean, communication through the senior center, once they were starting, open up a little bit more, gave us access to that population again, because many seniors are definitely afraid of computers and having access to that. So we tried to go to where the problem was rather than have the problem come to us. And is it 100%? No. I mean, are there things that we probably could have done, should have done better, or we're making those adjustments on the fly? But as Kate said, I mean, our goal was to be as inclusive as we could to get obviously going door to door, the results of the affordable housing survey are significantly higher than just what the broadband survey was. But even the broadband survey, as of last week, I think we had maybe close to 400 responses, which is pretty good for a community of 10,000 people. The housing survey is much greater than that. I mean, it's definitely in double-digit percentage in terms of responses. So I think there's a lot of good information we're going to learn from that, and probably some things that we're not even thinking about doing that we will be doing as a result.
I'm the director of the library in North Providence, and I was thinking, have you reached out to the Warren Library to see if they could put the survey on their computers there or make paper copies for everyone? Because you keep saying the diverse populations, and the library is the one place where everyone goes, where it's the great equalizer of society. So if you have the elderly, the young, people who can't type on a computer themselves, all those people come to the library. So to have a survey there with one of the staff members, the director, or one of the reference librarians, that would be a good point to start. Have you reach out to them at all, or do they work with the library anymore?
The HES did. We did not do the broadband survey with the library, and we should, because they've got a sign in the back that people sit in the back parking lot and use their internet, which is great. I mean, and that's what it's set up for.
Yeah, people go to libraries for the internet because they don't have it at home, so that's a great way to figure out who needs it and what to do with it.
No, that's a good point, and they're right next door, so there's really no excuse for me not to do it.
Last call. All right, well, thank you again.
Thank you. Thanks, Steve.